of meningococcal meningitis. Because it's a bacterial infection, what do you think we use or we should use to treat it? Bacterial
Antibiotics.
infection. Which one?
Antibiotics.
Antibiotics. Okay. Yeah. So we use antibiotics to treat this kind of infection. So just stay alert. Can be any broad spectrum antibiotic or maybe a targeted one. Okay, depending on the cultures. All right. Okay. Um. So like I said, depending on the cultures, ceftriaxone is one of the broad spectrum antibiotics that can be used, or maybe vancomycin, right? And remember, I also said with supportive care, okay, while the antibiotics are targeting the causative organism, then supportive care too will help keep the person alive. Because if the person is dehydrated because of sepsis, and we don't give the person IV fluid or fluid replacement, the person might die because of dehydration. Okay. And if the person's blood, I mean SpO2 or oxygen saturation levels are going down, we have to support with oxygen. Otherwise, the person might arrest because of what um oxygen levels going down. Okay, or this dyspnea or hypoxygenation, whichever. And seizures too. We talked about that. You don't want seizures. All right. Let's look at this one. Someone should read this for us. Our first question here. Let's go through them quickly.
A
On
patient
meningitis.
treated. A patient being treated for viral meningitis arrives at the hospital reporting a persistent severe headache. Which nursing intervention is most appropriate for the patient? 1. Telling the patient to use analgesics. 2. Informing the patient that headaches can occur after recovery. 3. Informing the patient that a headache is not a major complication. 4. Informing the patient that a full recovery from viral meningitis is not possible.
Okay. Who wants to try? Should you hear this question on the English? What answer will you choose to pass?
I
For
think
me, I'll go with 2.
You
Yeah,
choose two to pass, eh?
I don't know why, but
Okay, Jacob, your hand is up.
Yeah, I'll go with 1.
So you choose one to pass, right?
I'll choose 2.
Okay. So between 2 and 1. Okay. Anyone with different answer? Or is between 2 and 1? Okay. 1. Why 1?
Okay.
Sir,
If
I'll
you read
choose
the
1
question,
because it's saying that the
if you
headache
read
is
the question,
persistent
that
and
what you are going to do is to relieve the patient pain, because the question says that the patient being treated for viral meningitis arrives at the hospital reporting persistent severe headache. So me, I'm thinking that currently the patient most important issue is the severe headache. And the question says which nursing intervention is most appropriate for the patient. So they are also talking of intervention. So question 1 says that telling the patient to take tell the patient to use analgesic, and then the other one say informing the patient that the headache can. So me, I'm seeing that the one is some kind of you're kind of intervening, doing something to take care of the current
Pain.
problem the patient.
Okay.
Yeah,
Okay.
and I also think that the fact that the pain is severe, you shouldn't ignore it. You should give analgesia. So I also go for one.
Interesting.
I'm also thinking supportive care.
Interesting. iPhone, your hand is up. Hey, iPhone, you've not
Yeah.
been able to change your name again, eh?
Yeah, so Brahima, the same iPhone or Tony.
Okay. Mm-hmm.
Yeah, so I am also going for two. Going for two because the fact that the patient come to the ward, the hospital telling you of the headache doesn't mean giving the analgesic should be the immediate thing to do. They are asking of the most
Mm-hmm.
appropriate. So before you even think of the analgesics, you have to let him know that the headache can occur after recovery from the condition he had. Then you can think of the
Mm.
analgesics and others.
Okay. It's a very tricky one, even though it's a tricky one. Hey, we have more hands up. Hussein, come in. Then I think we have another iPhone.
Okay, so personally, I think I would have to also go for two. In that the patient is being treated. It means
Mm-hmm.
the treatment regime is not over yet, and probably maybe the
Yes.
patient might have maybe analgesis already
Mm-hmm.
in there.
Mm-hmm.
So probably maybe the number one could be that the patient is already having these painkillers and other stuff. So maybe the number two will make more sense to me, honestly.
Some people are analyzing the question well. Oh. Now eyes are opening, right? Okay. I saw another iPhone. Oh, you don't want to talk again?
Okay. I was also going for two because of the persistence there. It
Okay.
means the person is having like the headaches is always there.
Okay.
Yeah.
Okay. Thank you. So the
That's
answer is two. Okay. Yes, the answer is two. So even after being treated, you can have some headache. So this is something you should know about meningitis. Okay. The patient is being treated anyway. So it means yes. I mean let me leave it exactly as it is. The patient is being treated for viral meningitis. And telling the patient to use analgesics, it's like if the person use analgesics, the pain is expected to go right away, or like analgesics will kill everything. That is how, in one way, I understand option one, right? But technically, with regards to meningitis, you can have headaches. The headaches that comes with meningitis, because of the meninges, is going to be severe, even though it should be evaluated. Okay, but headaches are expected. Okay, and even though yes, we manage with analgesics though. So whatever we said, okay, all of us on, or let's say about option two, they are all correct in one way or the other. All right. I understand option one to severe, and I mean severe headache we have to treat, but treating it with analgesics, like option one mean to me like after taking analgesic you should expect it to go away like right away. All right. So that is another thing. What about giving a very like a broad spectrum antibiotic? Should it be a select or that apply question? Can that also be an answer to it?
No,
No,
because we are dealing with a
it's a viral
viral condition.
meningitis.
Okay. All right. So our eyes are opening. Okay. So this is the answer. Any question on this one? Okay, our second question.
The public health nurse is giving a lecture on potential outbreaks of infectious meningitis. Which population is most at risk for an outbreak? 1. Clients recently discharged from the hospital. 2. Residents of a college dormitory. 3. Individuals who visit a third world country. 4. Employees in a high-rise office building.
We spoke about this yesterday, right? You see, you have a question on it here. What's the answer?
2.
Yes, it's
There
2.
are two.
Do you all agree it's 2?
Yes.
Yes.
Because we spoke of it, right? Those of you who were in class. All right. So can we move on?
Yes.
Okay. Our next question. I gave you an assignment. You remember?
The nurse is assessing the client diagnosed with bacterial meningitis. Which clinical manifestation would support the diagnosis of bacterial meningitis? 1. Positive Babinski's sign and peripheral paresthesia. 2. Negative Chivostek sign and facial tingling. 3. Positive Koenig sign and neutral rigidity. 4. Negative Trousseau sign and nystagmus.
3.
3.
3.
Hey, this
Yeah, the
one.
answer is 3.
3.
Look at how fast we are. So did we all take time to look at the assignment I gave you? I think someone dropped a picture on the page right after the class, right?
Mhm.
Yes,
Beatrice.
please, I did send it there.
Yeah, so when we talk about Shivostek sign, what does it mean or how is it like? Let me see if I can show them here. Those of us, those of us who visit the masterclass page every month. I don't think those of us here who are like that have seen the picture, right? Someone didn't visit the page the whole of yesterday. True of us. Okay, so who can tell us like how is it how is it like the Shivostek sign?
There's some twitching. Okay. So the cheek tends to um, twitch when you when you touch the cheek.
I don't
And
get the
tingling
explanation well.
sensation.
Mm-hmm.
Tingling sensation.
I was
And it's
Mm-hmm.
saying that
mostly unilateral.
the Chivostek, okay, there will be some twitching on the person's cheek when you tap or like when you touch, when you apply some light strike on the cheek.
When you
The cheek.
stroke it, that's the word.
Okay. Okay. So when you tap the face, when you strike the face, when you I don't know whichever word, but if it means the same thing, then that is fine. Okay, so here is Shivostek sign. Okay, Shivostek sign. Whenever you remember Shivostek sign, the signs are plenty. So in order for you not to be confused or to make them together, match it with Trousseau sign. Okay, match it with Trousseau sign because they all indicate similar thing, so that you can group them all together, right? So all of these ones represent hypocalcemia. Okay, severe one. When you tap the person's face or strike or stroke, whichever word we are using, okay. You see, like this one, the hand is tapping the face here. You see that twitch sign that the person makes, okay, to that side of the face which is being tapped. Okay, so this is one sign of Shivostics sign. So on the ankles, they can give you this sign. So you see, the trousseau, it's always represented with this picture, like a picture similar to this. So whenever you see this picture, think of trousseau. Okay, whenever you see this picture, think of what Shivostics. You should be able to recognize this picture and what they mean. These two mean hypocalcemia. And you see the trousseau. Trousseau sign is when you inflate a calf, okay, on the proximal part of your arm. You should find the distal part of your hand having spasms. Okay, so over here you see the calf is being inflated at the proximal part. You see the calf is being inflated here, and you see the twitching. Okay, it's like the hand is in spasm, like having some spasm over here. Okay, you know this is not the normal anatomical position or yes, position or let's say representation of the hand. You see that the hand is like kind of stretching here. So these two signs represent hypocalcemia. Just take note of it. Okay, it has nothing to do with meningitis. I included it here because most of the times they mix it up with the other two signs. The sometimes they even mix it with Babinski, and Babinski, Brzezinski, sometimes they can be confusing because they all start with B. Okay, and Koenig sign, especially, yeah. So Koenig, Brzezinski, Babinski, Shivostek, and Trousseau, they normally mix all of them together so that they will confuse you. So I want us to draw a clear differentiation here so that you can match them together. Trousseau, Chivostek, hypocalcemia. Simple as that. Okay. Now let's look at the other two assignments. Babi, no, Buzinski, right? Oh, so Buzinski sign. Which one should I give him? So look at this one. So Buzinski sign should also move with what? I think this one. I don't know if it will clear. So you see, with regards to sister, sometimes when you open a picture even like this, it will remain blurred for some time. If the network is strong, then it will clear up. Sometimes it even happens to pictures like this, right? So look at how this person is performing the sign. Okay, first one here is Koenig sign. Okay, the Koenig sign. So you see the person will lie down flat. Okay, will lie down flat. Then the healthcare provider or whoever that's performing the sign will or whoever that's performing the action, okay, will raise the patient leg up, okay, and flex it at the knee and hip. So you see the whole leg is being raised up and it's being flexed at the hip level, it's being flexed, and at the knee too, it's being flexed, whilst the other leg lies flat. Okay, whilst the other knee and everything lies flat. And you see if the person feels a very like sharp pain, okay, upon extension of the knee, like of the other knee, then you know that um Koenig sign is present, okay. Okay. So I'm repeating it again. It depends on how you explain it, but the first thing is that the patient should lie flat. The knee and the hip, they are being flexed, okay. And when the patient,
Please matter your voice more for us.
oh, okay, sorry. Can you hear my voice now? Is it better or is still not okay?
Okay, we manage.
Hello, is it okay?
Today there is like it's
Yeah.
down, but it's okay.
Hey, my voice is down.
Yeah, and they are not saying it, but they are on comment section.
Oh, I'm coming. Let me see something.
We can hear you.
We
I
can
can
hear
hear you.
you.
Yeah.
You can hear me, eh?
We
Yeah.
can hear you
It's
Oh,
clearly.
me
clear.
too, but it was down. That's what I'm talking about.
I
Okay,
can hear you.
okay. I don't know what. I've increased everything here.
Or
We can
maybe
also
it's from your side. Mm.
We can hear
you,
you,
you
The
please.
one who is
okay. You
asking.
can also increase your volumes and see. Okay. Uh-huh. All right. Thank you.
Okay.
All right. What is this? Oh, I even closed it. Let me see. Okay. Let me give you the sign again. Okay. So where is the other sign? Okay, fine. You can use any. Okay. I want a clear picture. Okay, so I think we can use this one and see if it's gonna help. Okay. So there is the Koenig sign. The knee and the hip will be flexed while the patient lie flat. Okay. While the patient lie flat. And what will we see? There will be pain, okay, or resistance when the person tries to flex. When the person tries to what, extend the knee with the hip flexed. So um it's with this leg, okay. The knee is flexed here and the hip is also flexed. So upon further extension of this leg, the hip is flexed here and the knee is also flexed here. So when the healthcare provider tries to further extend the leg up, okay, a pain is felt, especially around the calf here, a very sharp pain, even though it's not normal for most of, most of us to, lie flat and to be able to raise up the leg, okay. But this is one sign to see if the person has meningitis or not. So hip, the key words to Koenig sign is that the hip is flexed, knee is flexed, then upon further extension, like as the direction goes, upon further extension of this same leg, a pain is felt here at the calf, especially. So that's Koenig sign. Okay. All right. You can have lots of pictures to demonstrate that. All right. Then look at the down part, the Brzezinski sign. The Brzezinski sign is the person will lie flat. Okay, the person will lie flat, and when you try to flex, so you see the healthcare provider or the one who is performing the action is trying to flex only the head part, right? Let me pick my pen. Initially, the person was lying flat, and the healthcare provider is only trying to flex the neck. Okay. Then by doing so, the person flexes the knee too. Okay. The person flexes the knee too, and sometimes the hip, like involuntarily. Okay, because of the pain that the person feels. Okay. Yes, and um that is a positive Brzezinski sign. So flexing the neck while the person involuntarily flexes the hip and or the knee, okay, because of pain. That is positive Brzezinski sign. I'm repeating the Koenig sign, flexing the hip, flexing the knee, and by extending the distal parts of the leg, the patient feels pain, okay, especially most of the times around the calf area. That is Koenig sign. So Koenig sign, remember it's the leg we are moving, okay, to elicit or to confirm the diagnosis. Brzezinski sign is the head that the neck that we are moving, and the patient out of pain, there will be like involuntary reflex, okay, that will make the person flex the knee, and over here too, you see some kind of, some small flexing of the hip. Other than that, it should be straight in that lying position, okay. So that is Koenig, that is Brzezinski. We've learned about Shivostek and Troso that they are for hypocalcemia. So KB, all right. KB, that's Koenig's and Brzezinski are for what? They are for meningitis. So just take note of the signs. When you see the pictures, you should be able to answer the questions. Any question on them? And I gave it out as assignment, so I expect everybody to know what they are. All right, let's carry on to what is it? Let's move on with what we are doing here. All right. So yes, of course we are correct. We are all correct. The answer is positive Koenig sign and nuclear rigidity. Another name for nuclear rigidity is what?
Next stiffness.
Neck stiffness. Okay. All right. Let's look. We have another question here.
The nurse is assessing the client diagnosed with meningococcal meningitis. Which assessment data would warrant notifying the healthcare provider? 1. Peperic lesion on the face. 2. Complaints of light hurting the eyes. 3. Dull aching frontal headache. 4. Not remembering the day of the
Please, I can't see you. Is it my network?
Your network.
We can see why.
Check your network.
Let's carry on.
1.
So the answer is 1.
One.
Yeah.
Yes.
Okay.
Yes, one.
Which indicates what?
Sepsis. Impossible DIC.
Okay. 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 All right. Please, if you know or if you don't agree with the option 1, let us know so that we can help you. Okay. All right. So the answer is
I'm
1.
set. Please, what
Yes.
happens to the answer 4? Is it unexpected thing?
I'm not remembering the day of the week.
That's
Um,
like altered mental status, is it?
it doesn't confirm that.
Okay.
Yes, it doesn't confirm that.
Okay.
When okay, let's look at the question. The question says a nurse. So the nurse is assessing the client diagnosis. So the client is already diagnosed with meningococcal meningitis. The diagnosis is there. So um, when you upon assessment, when you assess patient and let's say you are assessing level of consciousness, you ask patient orientation, right? Whether the patient is oriented to name, time, place, and all of those things. It's not, I think we've been doing this every day when we go to work, right? Assessing patient orientation and level of consciousness. If the person doesn't remember, sometimes the person is conscious, the person tells you what he or she needs and everything, but the person doesn't remember the day. It's very common because of hospitalization. Even though the person is very conscious, the person can walk and say something. I mean, do a lot of things for him or herself, but the person will not remember what day it is or maybe the date, and that is not any big issue. Okay, that doesn't call for you to, um, I mean, tell the healthcare provider of sudden. If let's say there's a sudden change of level of consciousness, then that is a warrant. Like the person was, let's say the person had a GCS of 14 or 15, and all of a sudden the patient has a GCS of maybe 9 or 8. That is a significant change of level of consciousness, or maybe something like that. Or if the person is very oriented, and all of a sudden, like the person is either times one or like zero, you see the person dipping. Those changes you can report, but just only remembering the day of the week. I mean, not remembering the day of the week. It doesn't warrant for anything. And it's not a strong point to explain altered mental status. It's not a strong point. Okay. All
Okay,
right.
so is it expected with meningitis, or it's a general thing for hospitalization?
For which one, not remembering the day of the week.
Yes.
Some will remember, some will not remember, but it's not a big issue. That one alone is not a big issue. Okay. That one alone is not a big issue. Between 3 and 4, why wouldn't you even choose 3 even more than 4? I see 3 to even be a strong point than 4.
I
Okay.
think it's expected. That one is expected in
Yes,
meningitis.
and they are all expected. Yeah, of course. They are all
Mm.
expected. But not remembering the day of the week, that alone is not a strong point to tell you that there is a sudden, no, it's not a strong point. Okay. So if you remember yesterday what we talked about, whenever you have, please, this one link it to all infections, okay, not only meningitis. So whenever you have any condition that is an infection, and you find this purpuric rash anywhere on the body, it's an emergency. So don't link it to only meningitis. Okay.
Okay.
So yes, it's an emergency. All right. So the answer is 1.
Okay.
All right. I think we have maybe our last or yeah, our last question here. Or last but
Hello,
one.
sir.
Hmm?
Sir, please, what about is it petechial rash? Is it the same thing as the
So
peperic?
either you see purpuric or petechial rash. You can't see both of them being in options like this. Okay. So either you see one of them, okay, in infection. When you see either petechial rash or purpuric rash, in any form of infection, take it as a complication and it's an emergency situation that you have to report to your healthcare provider. Okay.
Okay,
Yesterday
thank you.
we mentioned it. Yeah, I mentioned either purpuric or petechial rash. So any of them, they are all bleeding under the skin, but the nature of the bleed is different. I think purpuric rash is like they are all joined together like a large one, something like that. And petechial are like rash, like you see them dot dot. I think that's the only difference also. But when you go, you will see the difference. They look similar, but the nature of the display is different. That's why they have separate names, right? All right. The next question.
The nurse is preparing a client diagnosed with rule out meningitis for a lumbar puncture. Which intervention? Which interventions? Hey, which interventions should the
Your mouth is
nurse?
dry like mine there. Mhm.
Which interventions should the nurse implement? Select all that apply. So one.
Okay, so let's do this together.
Okay.
For us, I mean, select all that apply questions. Let's do it together. The first one. So understand the question before you even start choosing your answers. Um, the client is diagnosed of what? Rule out meningitis for lumbar puncture. So interventions the nurse should implement, okay, during the lumbar puncture. The first one says what? The first one says what? Obtain what?
Obtain an informed
Mhm.
consent from the client or significant other.
Do we think it's necessary?
Yes,
No,
please.
yes.
Yeah, yeah. I think to seek consent from the client,
Before
him or
Yes.
performing.
herself, is
It's
important.
an invasive
But I'm not so sure
procedure.
about the significance side,
Yes.
though.
Yes.
It's an invasive procedure.
Yes. So from the client, if the client is conscious enough, and from
Yeah.
significant other, if the client is not conscious, right? That's what it
Okay.
means.
Yeah.
Okay. Option two.
Have the
Yeah.
client
Have the
see the bladder prior
Um,
to the
let's
procedure.
hold on. It seems someone has a
But
question.
yeah,
Yes.
I learned a doctor that obtained consent.
Oh yeah, so I think we've thought about this one before when we were doing consent form, I mean ethics and ethical principle. We said there will be, I mean, you can get questions like this, and questions like this doesn't necessarily mean you, the nurse, is the one directly obtaining the consent. Okay, it's like the whole general, I mean, the general procedure. What should be in line before we can carry on? Okay, so a
Yeah.
consent must be there before we carry on with this procedure. That's how technically it means. Okay, when solving NCLEX question, unless the question tells you the nurse should obtain, you see, the nurse should obtain a consent form. And if it's a consent form question, generally, if it's a consent form question and the question is telling you that you, the nurse, obtain a consent form, then that is a no-go area. But this one, the question doesn't necessarily rely on consent form. Okay, it's relying on um lumbar puncture, like as in general. So when this is like a trick, you get this what I'm explaining with experience when it comes to English questions. So when the whole idea about the question is something else, it's not about consent form or legal issues, then you understand it in how I'm explaining it. Okay, like obtain an informed consent from the client or significant other. What it means is that make sure that there's a consent form before um, the procedure is being carried out. Okay, so when it comes to even the operating room, as part of our pre-op management, right from nursing school and even on the NCLEX, you know that obtain consent form is also there. Like, make sure there's a consent form before you access with anything. Are you aware that it's part of the pre-op management?
Yes.
Yes.
So it doesn't mean you are, the system has made it clear everywhere that you, the nurse, you do not seek consent directly from the patient. Okay, but it is your responsibility to make sure that there's a consent form. All right. So when you get questions like this, it doesn't mean you, the nurse, you are the one going for consent, because, of course, you are not the one who is going to puncture the space, okay, to pull out the CSF. You are not the one who is going to insert the needle. So you can't see consent, but you can make sure that there's a consent form. So that's technically what this means. So it's good option to choose when you get questions like that. I don't know if you understand the kind of explanation and the difference I'm trying to cite here.
Yeah, I have.
Do you understand what I'm trying to say? If you don't
Yes,
understand, you
please.
can let me know.
It's like you, the nurse, you are still an advocate for the patient.
Something like that, yes. Okay. And I know we have new people here, but those of you who were here when we did the ethics and the ethical, they are on the site, they're on the website, and I think I placed them on the on our dashboards. Okay. When they're asking you about consent from, like, maybe a patient is going for a procedure, and if the whole question idea is about legal issues or about consent form, then you should make sure that it is the doctor who is seeking the consent. That one, the nature of the question, the idea of the question will even tell you that it's a consent form question or it's a legal issue. This one is about, like, lama puncture in general and intervention. So you don't overthink to that. So someone said, English, when you overthink, or when you think that way, they are saying you overthink. If you don't think that way too, they'll tell you that you have to think deeper. So what should we do? Someone asked this question. All right, Sister Abigail, I saw an Abigail's hand up. Oh, are you okay?
Yes, sir. Please. Yes, please. Yes, please.
You are okay, eh?
Yes, please.
Okay, all right. Okay. Any other question? All right, so let's carry on with this one. What about option two? Can you read it for us? Who is reading for us?
Have the
So the first
client
one is
empty the
correct.
bladder prior
Mhm.
to the procedure.
Do we think this is also necessary?
Yes.
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 It has to be done.
Yes, even for all surgeries, you know that. This is like one of the standards for all surgeries.
Good.
General pre-op management. Okay.
Mhm.
All right. Then the third one.
Yes.
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 Fetal
Yes,
position.
that's the
All
Place the
right.
position for the.
client in a sideline position with the back up. Okay.
Okay. So if not sideline, what other
Yeah.
position is acceptable for this procedure?
Mhm.
Fetal
Setting up
position.
position.
Setting up.
Setting up. This
Sitting
is
up
fetal.
position with what?
Yeah.
Leaning forward.
Mhm.
Yes, and leaning forward with your.
For the
With the
bedside
knees
For the
flexed.
vertebrae to open.
Who is talking? Yes, so leaning forward, sometimes wrapping your hand over like a heart stable, okay? So that the heart, sorry, I said the heart, the vertebral
The
column
vertebral
arcs
column.
out, okay? So the
Yeah.
vertebral column arcs out, then you can get a clear opening. What level or at what space do we tap when we are doing this procedure? Where do we insert the needle? Between what and what?
Third and fourth lumbar.
L3, L4.
Between L3, that's the third lumbar vertebra, and the fourth one, or
4 and 5.
Third
4 or
and
5.
fifth.
okay, okay. So 3 or 4 or 4 or 5, right? All
Okay.
right. Okay. So this is also part, right? What about option 4?
No. No.
Why is it wrong?
The client needs to be still.
Breathing rapid.
Okay. So we breathe rapidly. This even alone should negate the whole thing, even if the rest of the sentence is correct. Okay. So this is one trick. How you can throw away options, like bad options. Even if the whole sentence looks good, there's only one thing that doesn't look good. It makes the whole thing wrong. So take note. So we can't choose 4. What about option 5?
Yes. Yes.
Yes.
Yeah. So the answers are 1, 2, 3, and 5, right? Do we all agree?
Yes.
Okay. All right. Yeah, so that's the rationale. I think we have our last question, then we move on to the next thing. Okay, this is our last question. Someone should take it for us.
The nurse is caring for a client diagnosed with meningitis. Which collaborative intervention should be included in the plan of care? 1. Administer antibiotics. 2. Obtain a sputum culture. 3. Monitor the pulse oximeter. 4. Assess intake and output. 1.
Mm-hmm.
1.
Administer antibiotics.
One.
Why are we choosing one?
Because the client has already been diagnosed. So let's hey.
We use
Use
antibiotics in
antibiotics treatment.
treating
Okay.
meningitis.
Okay, good. And there's one thing too over here. Which collaborative, okay, intervention, collaborative. So it means the doctor has to order and the nurse has to do it. It's like a collaborative something, right? And the person has already been diagnosed. I know this one too can be a collaborative, but the person has been diagnosed, so this is not needed now. Monitor the pulse oximeter and intake and output. Does this fall under collaborative intervention?
Yes.
Are you sure?
No,
No.
Those
that one
ones
can
are
be done by the nurse alone.
Yes, this
That's
one, leave the
independent
nurse.
nursing.
Good, good. So the collaborative ones are 1 and 2, and the person has already been diagnosed. So this is out. Now this your answer left. You see how to eliminate nicely. Okay.
That is when you
So
know.
that
Mm-hmm.
yes.
So
And that
when
is
would they do
that's
the
why we are doing what we
so
are
does it
doing.
mean that they've already done the culture and sensitivity or whatever?
Yes, that leads to the
Like,
diagnosis. So if they tell you the person has
no,
been
you see,
diagnosed,
mostly like when you want to administer antibiotics, they'll tell you like take the sample first. Or
Yes.
this one is it because it's a sputum culture? The
okay,
question
yes,
is saying diagnosed.
yes. So you see,
The
good. There are two things here. Okay. One, we don't use sputum culture to even diagnose meningitis, or we can use it.
no.
No.
Okay.
No.
Yeah. Do you know something? One way or the other, you can't use it to diagnose though, but sometimes it helps. Do you know why? Can someone tell me? Do you know that sometimes you can have respiratory tract infections moving into the bloodstream to cause this one? Staphylococcus. I don't know whether it's group A or group B. So sometimes when especially those of you who have read this condition, let me remind you if you remember. Um, especially pediatric children. Um, what am I even saying? Pediatric pediatrics, okay, or among
Mm.
children, okay. When they get there's they pilot something, there's a kind of kidney disease that they normally get. And the question that when they come to the hospital, we ask them is, have they had any recent upper respiratory tract infection? Who has seen that question? Or that
Glomerulonephritis.
good. Glomerulonephritis.
Post-streptococcal
Good,
acute glomerulonephritis.
good, good. So you know it's caused by staphylococcus, right?
Yeah.
Strep.
Streptococcus rather, not staphylococcus. Good, good.
Yes.
So streptococcus, good. So it's upper respiratory tract infection. They cause upper respiratory tract infection. So these streptococcus organisms, when how they cause the kidney disease is they escape from the upper respiratory tract and get into the bloodstream and get their way into the kidneys. Okay. So this is just a trick. Okay, just in case you get pediatric maybe person and the person has a kidney disease, or like especially the diagnosis is mentioned like glomerulonephritis, and there's a question like or there's a question like which question is appropriate for the nurse to ask. Okay, and an option says like has your child had a recent upper respiratory tract infection? Most of the times, about 90 to 99% of the times, that is the correct answer. And the reason is that those Streptococcus organisms, they easily escape from their colonized area into the bloodstream and cause, that infection, especially in children. Okay. And for these same organisms, they can get into the bloodstream, they can cause encephalitis, they can cause meningitis too. It's very possible. Okay. So sometimes they would want to rule out that. I mean, that is one way to think. Okay, even if it's possible, but I mean, we can't relate it directly to this question because the question tells us that a diagnosis has been made, and if a diagnosis has been made,
Made.
yes, there's a culture before you make the diagnosis. So technically, this is even out. The option two is out. If the question says the person has been diagnosed, okay, yes. So that comes back to our one, which is administer antibiotics, and that is also a collaborative intervention. The doctor will have to order. That is one part of it, and you, the nurse, you will have to what administer. Any question on this one?
So does it make it
So
like the
please
answer is
let
only
the
number
pharmacy
one?
to issue the drug.
You are overthinking, eh? There's no pharmacy here. So administer antibiotic. I mean, well, if that is an easy way you can understand, that is fine. But um, it's between the ordering. If you look at how settings are being made, sometimes when you limit the thinking to only your workplace, you might get things wrong. Okay, over here in the US, how these people their system is, even though it's the pharmacist who is responsible for all those drugs and everything, but you already have your physics room. The physics is like a machine, a very big machine where you have every medication already inside. Okay, the machine in like on your ward over there, we have a room for it. So as far as it's been ordered, just go in there and you pick the medication, like it's already in there. Okay, so they have a different system here. You don't have
Oh,
to
okay.
go to Yes, you don't have to go to the pharmacy for anything. Like it's a big room. You enter the patient's name. You pick you select the medications on the screen, and it will pop up. Okay. It's like a
Okay.
tray. The machine will just bring it. After you pick it and you close it, then the next, if you are picking lots of medication, they'll just be coming out. Okay, and you pick them. It will tell you pick it from this one. It's a nice system. One day we'll look at that. Okay. Yeah. So their system is different from how back at home our system is. So you don't have to think plenty like you have to go to pharmacy for it.
Once the patient is diagnosed, they
Oh,
can go
okay.
and
Thank
fill
you.
out
You're
the
welcome. Okay. So I think we all agree the answer is one. Okay. So let's look at, I think we have already talked about this, but let's see if there is something left out. So influenza virus and incubation and refraining from coming into contact with immunocompromised. Okay, remember when we started this topic, I told you we are looking at, we'll look at hotspot areas among some of these infectious diseases, not to treat them fully, but when we get to them, we will talk about everything we have to talk about. Okay, so this slide talks about someone who has the flu virus, right? And how the person can transmit it to someone who is immunocompromised, even when that person infected hasn't shown signs and symptoms. That is what this slide is trying to tell us. So let's look at what we can learn from here. We are saying the influenza virus has an incubation period of 1 to 4 days, with peak transmission starting at 1 day before symptoms appear and lasting up to 5 to 7 days after illness stage begins. So it is transmitted by inhaling droplets that infected people exhales, okay, into air when sneezing, coughing, or speaking. So even when you are speaking and you are in close proximity to another person, you can give it to the person. Then if contact with others are unavoidable, okay, let's say you have a flu or you've been exposed, and if because of something contact with others is not avoidable, you have to wear mask, okay, which offers some protection against the virus. I mean, you transmitting the virus to others. That's what it's trying to say. Individuals with the influenza virus can transmit virus during the incubation period and illness stage of infection. So even when the disease is very physical, or like you can see the disease manifesting, or in the incubation period, you can still transmit the disease. Okay, it's like HIV. When you have HIV, let's say you are a newly infected person, and let's say it takes maybe 3 months or 6 months for you to show positive hair, whichever test you do on you, within your first or second month, you are still in the incubation period. You can still transmit the disease, right? Even though you are not actually positive because you haven't reached that stage, right? But because you've already been infected and you are in the incubation period, you can still transmit the disease. So it's similar to this one. Okay, even a day before the disease state manifests, if you've already been exposed, you can equally give it to someone, even though you are not sneezing, you are not coughing, and you are not having running nose. Okay, it hasn't, I mean, all those conditions haven't appeared, or all those symptoms haven't appeared, but you are capable of still transmitting the flu virus to others who get very close contact with you. That is what this slide is saying. So vaccination provides immunity against the influenza virus in 2 weeks after inoculation. So it even protects you that's after 2 weeks after inoculation. Therefore, it does not. So in fact, last year I took the vaccine, but I still had I still had a flu. Okay, like a small one. So it makes sense. People take it, and at the same time, well, not every time that you get,
Not,
but you are
it
still
doesn't
likely
protect
to get.
you throughout the year.
Yes, but I had it around this like I took it around early November, and I think later November I had a flu, or early December, something like that. So it's though it's an annual shot. So yes, so take note of this one too. Okay, the flu vaccine is annually. So when you get questions that is trying to ask you how often should you get the flu shot, it's annually. And pregnant women and immunocompromised people can also have the shot safely. Okay, so don't think if you are pregnant or you are immunocompromised, you can't have the flu shot. It's safe for all those people, and it's annually. It's I mean it's a pure English question, so take note of it. No matter how they try to trick you in the question, just remember that is how it's being done. All right. So it does not offer protection, like I mean complete protection against all viral strains. So just to let you know. Any questions on this one? I have a question for you. Someone should read it for us.
Sir, please, can I check the slides again?
Do you have it now?
Yes, thank you.
Can someone read it for us?
An adolescent client with several flu symptoms calls the advice nurse to ask about using cough suppressant. What suggestion from the nurse would promote better airway clearance? 1. Use cough suppressant during the night. 2. Use cough suppressant in the morning. 3. Use cough suppressant in the evening. 4. Use cough suppressants in the morning.
Mm-hmm. What do we think the answer is?
No, sir, I'll choose one. Hello.
Yes, I'm
One.
here.
I'll
You
choose
choose
one
one.
because most of the
Please, I'm listening.
cough
Oh.
suppressant causes drowsiness. Better you take it.
Okay. Okay. Any
Hello,
other?
Pat.
Any other? Mm-hmm.
I think one, because it also will help the patient to go to sleep.
Mm-hmm.
So I'll go for one.
You go for one. Anyone with a different option?
Use cough suppressor at night.
I'll go for in the morning.
Okay. So 9 people
I'll
have
go
given us
for
the explanation. In the morning, why will you choose in the morning?
I'm just
Remember?
choosing.
No, you can't just choose. At USRN Elite, you can't just choose any
Okay.
answer. I think you should know this
I
by
think
now. Uh-huh.
I think with the first answer, use cough suppressant during the night. With the cough suppressants, I think they have this ability to make the patient dizzy or people dizzy. So if you take them during the day, especially somebody who works with machines, you can't drive and those things, it will be difficult and to make you
Are you
drowsy.
sure? Are you sure
So
some expectorants don't also make you dizzy? Are you sure?
please come again.
Okay. Are you sure some expectorants don't also make you dizzy? It's only cough suppressants. This is Stephanie.
Sir,
Yes,
please, what's of
expectorants
number
also.
three? Sir, please, what's of number three?
Are you choosing number three? Or you asking
Yeah,
of
well,
number
I
three?
was thinking that number three could also be a possible answer.
The answer is one. Okay. The answer is one. Those of
Say,
us who were saying the answer is one is true, but I'm just interested in your
say.
uh your reasons. Yeah.
I feel like
I
that.
think it's one.
Please, Rasma.
The humidity in the
Cause
night sometimes doesn't makes it very difficult for you to sleep. The cough mostly is very worse in the night. Yes, the
Yeah, by the
humidity
way,
makes
me, I have that issue. Every night I hardly sleep, so I
one
mostly
after
use
the other,
yes.
please.
extra drops.
So I feel like the humidity during the night makes the cough worse because I have kids and mostly it's in the night that you feel the cough is so bad. So I feel like if you take it in the night, it helps to suppress it.
Okay, okay.
Me, me with my own
Um,
mostly every night I have nose blockage, so I need to rely on medication during night time.
okay, okay. So thank you for your contribution. Note that we have cough suppressants and expectorants. Okay, those are these two medications that are used to manage cough. When someone is giving out something out of cough, like productive cough, which one do we think is best? Cough suppressant or expectorant?
Expectorant.
Expectorant, so that the person can remove all those flames out. Okay. When a patient is having or someone is having unproductive cough, which one do we think is better?
The suppressants.
The cough suppressant, because the person is not bringing out anything. So it doesn't make sense for the person to still, have that kind of irritation. It means we have to suppress it for it to stop. Okay. So before you can understand this, you have to understand cough suppressants and expectorants, what they do. Mostly, it's better to give suppressants at night to help with sleep. Okay. Sleep is also one kind of, in quotes, medicine. It helps to relax the body and that's a lot of benefits on the body. So you don't give expectorant at night. Otherwise, the person will, it will be difficult for the person to sleep. So most of the times you give expectorants during the daytime and suppressants at night. Okay. So that is one rationale. Who can give me an example of an expectorant? Have you seen the guaifenesin? That is one common expectorant the NCLEX normally mentions. Guaifenesin. Okay. And one example of a cough suppressant is what?
Dextromethorphan.
Yes, those dextromethorphan, simple linctus, and those things. Those are um, cough suppressants. Hussein,
Boss, I beg you, the expectorant, can you mention it again? Check like I didn't hear it well.
guaifenesin.
Okay.
Have you seen it before?
Yeah.
Yeah. So GUAIFENESIN.
Okay.
Okay. Yeah, GUAIFENESIN. I think it's part of your pharmacology drugs. You see it there.
Okay.
All right.
Yeah.
So at least even if you don't know,
What?
no one expectorant, no one cough suppressant as part of your pharmacology knowledge. It's better to help you one day.
Sir, please, you said with the suppressants. Which one?
Someone mentioned what's the drug the person
Simple.
mentioned? Yeah, I mentioned simple.
Dextromethamphetamine.
Yeah, I mentioned simple linctus, and the person mentioned what?
Dextromethorphan.
Yes,
Dextromethorphan.
Yeah,
yes. Do you get it?
the,
Or you want to
I
spell
just
it?
want to
Dextromethorphan.
no, no, I'm just giving some concern
Okay.
about the drug you
Uh,
mentioned, guaifenesin.
so sorry, just to even add up, codeine. Okay, I think even if you forget about anything, codeine. just remember codeine to as a suppressant. Okay. If the dextromethorphan is too big for you, but at least you can just take note of that when you see it somewhere. Okay. And codeine too is one example. Please carry on.
So I was saying there's an antihypertensive drug that may confuse you when you meet it with the guaifenesin. It's also called guanetidine. So if
Good.
you see that, you don't confuse yourself with the guaifenesin.
Good. Can you spell that for us?
Since it's like
Can you type?
GUANETHITHID.
It's been spelled in the comment section, so you can check the
Oh,
chat.
okay.
Yeah,
Okay.
Oh, okay,
Thank
thank
you.
you.
you're welcome.
The central acting. A
Okay.
bit centrally acting. Oh,
And I think I'm thinking there's another drug that helps with it's like it is for fighting skin infection. It also has that similar name.
please, it's not in the chat. Oh. Can the person type it? Oh.
Oh, please check where is there.
The
Please,
one the
please check
expect.
it. It's there. The guaifenesin. I'm
No,
going
Okay.
to.
no. What
No,
he's
that
saying is
was not
different to
one.
the guaifenesin. The
The
one
one
he's saying is
said we
it's
can
an anti.
differentiate between.
I think it's a centrally acting one. The centrally acting antihypertensive. We have clonidine, metaldopa, and that one that he mentioned. So I wanted him to type it on the page. It's similar to the guaifenesin that we were talking about, but that one he hasn't typed it.
What have I done?
There's stomatofen or what?
No, gua something. Please, can you type it there?
Or something, eh? Okay. So the person who said it can type it there. I
Please,
think you can. You know.
please,
Okay.
oh,
Mm-hmm.
what about
Is it on my side or it's from him? I'm not hearing him.
And it's
there's
always
one
have
called
bad network.
cromulin? I don't know.
Which one?
Cromulin or something. I don't know.
You were breaking. I wasn't. I mean, I didn't hear what you said.
I'm asking that there's also one of the medications called cromulin. Or I don't know.
Well, we have lots of medications. We can talk
What
about them
has it
later.
done?
For
What has it done?
Let us carry on,
no, it
okay?
was. Let's continue.
Yes. So I think the person has typed it. Guanetidine. Yeah, the person has typed it there, so you can check. It's a fresh.
Guanetidine. Okay.
All right. So that's how you learn every day, okay? Every day you learn one thing, you keep it, you make sure you don't forget, then you build the content. If you stay within a day and you don't learn anything new, it means you've wasted the day. Every day we grow, every day we learn. All right. So if you are here yesterday, you didn't learn anything new that you didn't know before, you've wasted yesterday. And get it, get something just to catch up. All right. All right. So, yeah, that is it. Let's talk about another thing here. Now, we are going to talk about latent TB and active TB, okay, tuberculosis. What is the constitutive organism of tuberculosis? Fast, 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 fast.
Mycobacterium
Mycobacterium
tuberculosis.
bacterium.
Tuberculosis.
Okay, so I think it's not anything new. We all know, right? Is it caused by a bacteria, fungi, virus? Which one?
Bacteria.
Bacteria.
Yeah, bacteria. Good. So we treat it with antibiotics. What is the famous treatment regimen? The abbreviation or the acronym we use is what?
Harry. They're right.
Perry
Dog.
and ripe.
Other.
You're
Dog.
right.
Whether peri or ripe. Okay.
You're
Yeah.
right.
So rifampin, isoniazid, pyrazinamide, ethambutol. Those are the four things. I think during the first or second lesson, we talked about the drugs, right? How you can look out for the signs and the side effects. Do you remember we talked about that?
Yes.
Okay. So we are going to look at over here. We are going to look at what latent TB and active TB means. Okay, even though I think we touched on it a bit, but we are going to look at them. Maybe we can draw a certain conclusion here, and we can learn one or two things. Okay. So um, let us look at what we have here that I can add up. An in duration of so first of all, before I take you through this in duration thing, we have a test. Okay, what is the popular test to fish out if someone has a TB? The first, at least our first thing that we do is what?
Tuberculin test.
Mantos.
The Mantox test.
Tuberculin
Okay.
skin test.
So when you see tuberculin skin test,
The Mantle.
what is the difference between that one and the mantle test?
The same
I know
thing.
I
I
know
think they are
you
the
mentioned
same
it's
thing.
mantox, but I mean I think it's mantle. That is what I think. Okay. So the
Okay.
mantle test and the tuberculin skin test, what's the difference between them?
It's the
They're
same.
the
It's
same.
just the name
It's the
they've
same.
changed.
Okay, good. Then what's the difference between the mantle test and the purified protein derivative test?
Not the same test.
Asemraba.
It's the same thing. Assembly and by. Okay. It's the same thing. So in your
Oh,
test,
no.
when you see
So repeat that. What's the name? The protein
purified,
something.
yes,
P-
purified protein. Let me see if I can write it here. Purified protein derivative.
Okay.
Um,
PPD.
yeah, PPD. So the normal purified. Okay. I'm very bad when I'm using my computer to write. That's why I don't like writing, unless I'm using a handy device. So purified, like the normal purified. Okay. And protein, the normal protein spelling. Okay. Then derivative, the purified protein derivative. It's the same tuberculin skin test and the mantle text we are talking about. Okay. So how do we perform this test? I want us to start from there, then I'll come to the induration thing that this slide is talking about. How do you perform this test? One, you should know that it's a skin test, okay, that is used to detect TB infection. We call, or I made mention of purified protein derivative because that is what is being injected, okay, intradermally on the forearm, okay. So that substance we inject intradermally on the forearm is what we call the protein, purified protein derivative. Okay. And remember we said it's the same as the tuberculin skin test. So when it's being injected intradermally on the forearm, so you can stretch out your arm and just imagine if you've not had some before. I think some agencies, I don't know if you are here and some agencies will even make you go for this test before as part of your immigration process, right? Not all agencies though. Yeah, so you will see how it's being done. Um, they will inject the PPD, that's the purified protein derivative, intradermally on your forearm, and it should form a small wheel, like a round something. Okay, under there you will see it, and you have to return. So your return time should be noted. The NCLEX will test it between 48 to 72 hours. So in some books you see them mentioning only 48 hours. Some books you see them mentioning 72 hours, but it's a wide window. So between 2 to 3 days, that is 48 to 72 hours. Okay. All right. And you will have to come back. When you come back, what do you think will be measured? Let me seek for your opinion before I even continue right from here. When you come back after 2 to 3 days, what do you think we look at around that site which was around that site which we injected the PPD? What do we check for?
Skin
Check
reaction.
for induration.
Are you sure we check for skin reaction? So that's why
The
I'm asking this
size of
question.
the induration is what
The
is
size
meant.
of the induration,
Good,
excluding erythema.
good, good. So that is what is very critical, or let's say crucial here for you to take note. We don't we don't measure erythema. Erythema means redness, okay? We don't measure redness around the site. So it's one tricky part that you can be tricked to get answers wrong. So you only measure only the induration. Induration means as like a raised swelling, okay, where that substance was injected. You will see a swelling, like a raised part, okay, a raised swelling over there. That's the meaning of induration. We don't measure redness or erythema like our sister said. So take note. All right, now with the size of the induration, okay, or that raised swelling where we injected the PPD, when you have a size, an induration size, so this one I think it's not it's not here, but we can listen and take note somewhere. When you have an induration size of, and I think you've seen it in Q banks before, when you have
Yeah,
an induration of 5 or more, so it means please
millimeters.
the induration sizes are measured in millimeters. Okay,
Yeah.
so take note. When you see, so when I mention the number, don't don't think of maybe any other measuring scale aside millimeters. So when you have an duration of 5 millimeters or more, okay, it means that is if only the person has HIV or the person is immunocompromised. Okay, if the person has HIV already or any condition uh, that makes the person immunocompromised, or we can say the person is immunocompromised, then it's a positive interpretation. Okay, the interpretation we can give to that 5 or more millimeters in duration size is that the person is what positive for TB. Okay, I'm repeating that when you have in duration size of 5 millimeters or more, and the person is HIV or immunocompromised, okay, or
Yes,
if the
sir.
person
It's
had,
like, I don't know, your line is breaking.
or there's another thing, or if the person had a recent TB contact. Is my line breaking? Hello?
Hello,
Yeah,
yeah, no,
like
it's
on
clear.
my side, it's breaking.
Is it better now?
Yes, please.
Okay. Sorry about that. So, if you have an induration size of 5 or more, and the person is HIV positive, it means the person is what? Is positive for the TB. If the person is immunocompromised too, it means the person is what? Positive for TB. Or if the person has had a recent TB contact, okay, a recent TB contact, an actual TB, if the person has had a contact, and the person gets an duration of 5 millimeters or more, it means it is positive for that person. All right. If you get an duration of 10 millimeters or more, okay, and you are a health worker, okay, you are a health worker, or you are an immigrant, or you've been to an area where, um, I mean, risk factors are high, okay, like you've been to endemic areas or high, I mean, high population rate areas, or like, yeah, or where you have poor sanitation and you have slums and yeah, all those things. Okay, those like when you have more populated areas, those areas are actually considered as high risk areas for TB. Okay, when you have an area where it's being populated, either a whole country or yeah, something, or a country which has a poor sanitation and poor measures to curb some of these diseases, that country is considered risk factor, high risk factor for TB. Okay, for TB contraction. So if you've been to a country which has a higher risk, okay, or if you are an immigrant, okay, if you are an immigrant or you are a health worker and you get an induration of 10 millimeters or more, you are positive for the tuberculin skin test. Okay. But if you are healthy and you don't have any risk factor, you've not been exposed to areas where TB can be prevalent, and you have an induration of 15 millimeters or more, then you can be positive. Okay, then you can be positive in this case. So now my question is, do you understand what I've just said before I ask you my question? Hello?
No.
Please come again for us. If you are a health worker,
So, a duration of 5 millimeters or more is positive for people who are HIV positive and immunocompromised, okay? And people who have had a recent TB contact. That's the first one. In duration of 10 millimeters or more, if you get that one, and you are a health worker, it means you are positive. If you are an immigrant and you get 10 millimeters or more, it means you're also positive. And if you've been exposed to countries which have high risk, it means you are also positive when you get 10 or more. The last one is the 15. Okay. And we are saying when you get an induration of 15 millimeters or more, it means and you are a healthy individual and you are not, you've not been exposed to any risk factor. Like you've not been to countries which have higher risk factors and all of that. It means you're also positive. Okay, when you get 15 or more. Do you understand it? Do you understand everything I've said right now?
Please,
So what's a
I want
health worker? Is it 5 or more?
Immunocompromised
no,
is
10,
5
10, 10
or
and more for the health worker.
Okay.
Yes. Yes.
but it's a little
So
bit
what if you are a health worker and you are also immunocompromised?
Then you don't fall within health worker category. You fall within immunocompromised category. Is it clear?
so that means if you have it greater than 5, that's for the immunocompromised,
Five,
or
five or more.
5 or
So
more is for the immunocompromised.
yes.
Okay.
this one, the boy, yeah, you should have added to this slide for us.
Is it too much to keep?
Yeah.
So please, I want to clarify something.
Yeah.
So um less than 15, you are not a health worker, you've not been to any country that will expose you to the disease, nothing, you're a healthy person. So less than 15 is negative.
Less than 15, yes, it's
Yeah.
negative. Yes, and if you are a
Oh,
healthy individual, it's negative.
okay. Thank you.
I'm looking at something if I can. Let me see. Okay. So I'll post it. Okay, I'll see if I can post it in the page. I'm in the page for all of us.
Thank you.
But with regards to that, right? I'm just looking at it right now. With regards to that, I want to ask you a question. If let's say I'm a health worker and I get an in duration of let's say 8, what does it mean? Am I positive or negative?
Negative.
You are
I'm
negative.
negative, right? Okay,
Negative.
if I'm a health worker and I get an in duration of 13,
Positive.
The
Positive.
positive.
if I'm healthy individual and I get an duration of 13,
You are
You are
Negative.
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 if I am a health worker and I get in duration of 10,
Positive.
Positive.
I'm positive.
Positive.
if I am an immunocompromised and I get an duration of 4,
Negative.
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 it's not simple.
Yes.
It
This
is.
one there it has become
Yeah,
nege
it
nege
seems
poor.
simple, but it's not.
Yeah. So you see that we've made it simple for everyone. Eh? Okay.
It's easy for us because we are in class right now. By the time you can mix it up.
Yeah.
Okay. I just posted it. Okay. I
Thank you.
just transferred it from my other phone to this one. Yeah. So you can look at it right now. Right.
Thank you.
All right. Okay. So
Obi
let's
pe
carry
power
on.
bank me bag mo.
Hey, we can hear you. Kindly mute. All right. Let's carry on. Hussein, let's go.
So, but,
Somebody's hand
but
is
please, so I've
You want
noticed
power
something
bank?
that
It's me
when
bag.
Oh, Mr. Madam Ifia, right? We can hear you. So Hussein, let's go.
yeah, so I've noticed
Yeah,
something that
basa.
if when I
Oh.
when children are being immunized for BCG,
Mm-hmm.
or let me say, yeah, BCG, the in duration, in fact, most people is almost the same. I don't know. So how do we detect, or maybe in a part of the world, sometimes we don't even know. If not today, I didn't even know that even with this in duration, it means something. I don't know. Some people have it large, some people may have it small though. But if not today, I don't know. I don't know. I don't know. I've never heard of it. So over here, it means the moment you are being injected or vaccinated, we believe that maybe you are being immunized against TB over here. So
Mm-hmm.
yeah,
Over here,
so
please.
I don't
Where?
know if
Do we understand his question?
No, me, I didn't
No,
understand.
please.
Please take it again, okay?
so okay, fine. Let me first put it this way. Is it the same as here, let's say Ghana, we are in Ghana, so let me use Ghana. So when these kids, young kids, go for BCG vaccination, you will see that the induration will come, and then as a bit like it will be like a wound, and then it will heal. So
Okay.
is it the same thing? My first part of the question should be this: is it the same thing?
I'm getting you, but not clear. But
I
do we
think
understand
he's
you?
trying to say that
Maybe.
can
I
we use
think
the duration to detect the uh, BCG? When you give the BCG vaccination, can
Okay,
we
okay.
use the duration to detect the negative or positive?
Oh, positive. Okay, okay, okay. So let me answer
Mm-hmm.
you with this one. When you get Enclave's question, okay. So I mean, your whole thing is effect of BCG like vaccine on tuberculosis skin test, right? In short, that is your question.
Yes, yes.
Okay. So one thing is that you should know that people who have received a BCG vaccine will always have what a false positive mantophis. Let us always keep it like that. Okay. People who have received BCG vaccine will always have a false positive. So because of that, um, doctors will not even use or prescribers will not even use the tuberculosis skin test. If we have another one, I think who has seen this I think IGRA or something like interferon gamma release assay. The English is not actually will not ask you about this, but just know that a different one will be used. Okay, a different one will be used. So what can help you to know if maybe when you get it in questions whether you should rely on the tuberculin skin test? So if the question is that the client, let's say, previously vaccinated with BCG, okay, or yes, if the question says that the client is previously vaccinated with BCG, note that the tuberculin skin test will not work. It will give you a positive, so a false positive um, tuberculin skin test result. Okay, are we there?
Mm-hmm.
Yes, please. Yes,
Hello,
Yes. So,
sir, please, your
so the
line is
next thing
breaking. I don't
is
know
my
if
line
it's
still
me.
breaking?
Please, can you check it again?
Yes, it's breaking.
Okay. Was my line breaking? The rest of us, so that I can position myself well.
Not really.
I think
Okay.
it's from here.
No.
Okay. So what we are saying is that, or what I said is that, when in the question they tell you that the patient has what has received a BCG vaccine or has previously been vaccinated with BCG, and then what we are saying is that they will always have what a false positive mantle test result. It means they've already been exposed, and the test results that will come out of the tuberculin skin test will be a false positive one. Okay, because they
Minister,
already
is it
have.
always?
Bosja,
Yes, I mean it's
how
always like that.
Boss,
how
boss,
Yes,
yeah.
early before will they have it?
it's one question, one after the other. What do you say?
I'm asking that you say if the patient had previously been given the BCG,
Vaccinated. Uh-huh.
yes, with the BCG. So how early before? 2 weeks, 1 month, 1 day, 2 days, hours?
So let's ask the question: how many times in a life should we get the BCG vaccine? It's not once.
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 Yeah, so it doesn't matter when.
But yeah, is it always that
Thank
the
you.
person can get the false positive test,
Yes, it's likely to be
the
false
skin
positive.
test?
Yes.
But you can
So
still be negative, right? You can
yes,
test
but
negative with the skin.
you can test. Okay, you can test negative. Anything is possible. But let us look at something. If you've already received the vaccine, the BCG vaccine, then why
Mm-hmm.
should we even go ahead? If we can't rely on the test
Okay,
result, why
so
should we
I
go
had
ahead and
an
even use the
experience with
test?
this.
Oh, okay.
Okay, I have an
A physical
experience
experience, eh?
with this. Yes, where yeah, that was in the States where they did the tuberculin test for us, like the skin test. So we're all
Mm-hmm.
Africans. So most of our colleagues tested positive to the skin test, but
Mm-hmm.
most of some of us didn't test positive.
Mm-hmm.
So I being a health person, I was educating them. Maybe it's because of the BCG we had. So they
Good.
had to do another X-ray. They did
Good. So,
X-ray
so,
for
so
them.
that's the next thing
Though
I'm about to say. Before
uh-huh.
questions,
But
before
it
questions come
wasn't
in.
all of us who tested the positive. But all
Good.
of us had, like, for Africans, we get the BCG. But
Good.
most people were tested positive, but not all of us.
Good.
Though we all had the BCG.
In the
So that's
US, right?
why, and is it always? Yes, in the US.
Good. Good. So that's what we are trying to say. So please, for English purposes,
Mm-hmm.
so you see, Nana Fatima. So for you,
Yes.
I think the system you went through, like it was like a standard for them to do the tuberculin skin test. It's like a protocol at
Mm-hmm.
where it was done. So
Yeah,
that
it
one,
was a
yes, it's a
protocol.
protocol. So they will just do it. Okay. But on the
Mm, okay.
NCLEX, okay, this is the trick on the NCLEX, or in real cases, aside protocols and specific conditions, if you already had a BCG, in fact, it's like we've exposed you to the organism already, and you are likely to show positive, and it's a false one. So on the NCLEX, when they tell you that let's say the person has been exposed to BCG already, I mean the BCG person already, or maybe the person is even positive, even if the NCLEX mentions that the patient comes to the department or ED and the patient is positive for PPD, that's purified protein derivative. Please, the next thing to check is what? Either X-ray or the IGRA. The IGRA is like a blood test, okay? It's a TB blood test. Okay, the one that I mentioned, interferon gamma release assay. IGRA, it is a blood test. So, but most of the times, it's the chest X-ray that they normally take after that. Then, the sputum culture will be the last one that will help diagnose with the X-ray. So they will do it with the X-ray to finally diagnose you. Either you have an active TB or you don't have an active TB. Okay. I don't know if you understand
Okay,
me.
thank
If I
you.
should repeat that.
Yes, yes, yes.
Do you
Yes,
understand me?
please.
Okay. Yeah.
Yes, please. Thank you.
You're welcome. So just get the NCLEX trick, okay? If the person has had BCG already, or the person is positive for tuberculous skin test or PPD, next thing is either the chest X-ray or the IGR. All right. Any other question? So that is what this slide is trying to say, okay? And I think we've added one or two things here. Right. Okay. Let's look at this question. Can someone read it for us?
A client has a 6 mm area that is slightly red and soft to the touch at the site of a PPD Mantos test. Which findings should the nurse document for this client? A. Negative response. B. Positive response if the client had an abnormal chest X-ray. C. Positive response. And D. Indeterminate response.
Mm-hmm.
I got you.
What do you think is the answer?
It's A.
Negative.
It's A.
It's A. All right. All right. I hope you all understand the answer. It's A. Yeah, I don't have rationale here, but it's A. Yeah. Any question on this one?
So if the patient is an immunosuppressant or an HIV, will it be stated in the question?
Oh yeah, they will tell you. They'll let you know. Okay.
Question, please.
They'll let you know. All right. The next question.
That I have a question.
Yes, you can ask.
So if it was not stated immunocompromised, we'll just assume that the patient is not immunocompromised.
Yes. If the person is immunocompromised, it will be stated.
Okay, thank you.
You're welcome.
The nurse is caring for a child diagnosed with tuberculosis infection. Which risk factors should the nurse identify that would greatly increase the risk for progression to disease? Select or that apply. A. Presence of HIV infection.
Is
B.
it?
Genetic factors.
Let's do this together. So, is it
Okay.
part? Is the first one part?
Yes.
Yes.
Okay.
It's part.
What about this one? The second one, is it part?
No.
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 The third one?
No.
Yeah.
Yeah.
Some are saying yes, some are saying no. Is it part?
It is.
Yeah,
It
because
is.
I think
it's
it is.
age less than 2 years, their immune system is
Madam,
rising.
the immune system is weak.
Okay. Let's put a dot to it. Then D, is it part?
No, so good again.
Yes.
Yeah.
Is it
Yeah.
the English?
Yes, it's part.
It is.
Yes.
It is part.
Mm.
Okay.
I didn't see
What about E?
It's part.
It's but
part.
Okay. So we have done well to get this question wrong.
Hey.
hey.
So wait, when
Hey.
when
Baby, yeah.
wait, should I tell you the answers are only two? Which one and which one will you pick? If I
The
give you a
Okay,
clue.
they will take
Based
A
of
and
HIV.
D.
A,
ANC.
A
A
and
and
D.
C.
Yes.
B and
A
E.
and D.
A and I'll take A and E.
A and
Okay.
D.
So people
A
are
and D.
so
B
let's
and
say
D.
A for the A is correct. That one we all know.
Yeah.
Then people are saying A and D, right?
Yeah.
Yeah.
D.
Okay. And which one? Who is also saying differently? So we are all choosing A and D, right?
Yeah.
So even after giving you second chance, you are
No.
still wrong.
A and E.
A
A
and
and
C.
E.
E.
A and E.
A
A
and
and
E.
E. After giving you
A
third
and
chance, you
E.
are wrong.
A
A
and
and
A
D.
C.
and D.
A and
Oh, A
D.
and C.
A
Age
and
less
C.
than
A and
2 years.
I'll
C.
go for A and C.
So the
A
A
and
answer is
and
A
C.
and
D.
But
C.
yeah, why are you doing this?
A and C.
Osbia
Yes.
is treating us bad.
Oh no,
A,
no, no. You are
A,
trying to
D.
figure out, a solution, okay?
It's A and C.
So the
A and
answer
A
C.
and
is A and C, okay? I know this
C.
C,
this is a
yes.
tricky one, okay? Please, the virulence of an organism, we all know how virulent tuberculosis is, right?
Yeah.
Mm-hmm.
When we talk about virulence, it's like the severity of it. It's not any
Okay.
different. We don't have one which is more severe than the other. Okay, so
Oh,
you
okay.
can consider that. Okay, you can consider that. Risk factors that the nurse should identify. Okay, that will greatly increase the risk of the progression of the disease. Is the first one, which is immunocompromised person and age less than 2 years, because it
Yes.
also has something to do with what immune system.
Mm.
Yeah.
Remember, TB falls like before someone can get TB, it falls within the boundaries of what immunity. You know that weakened immunity, because it's like almost everybody has a latent one. Okay, before it can become an active one, it relies more on what immunity. You know that the immunity has to come down before it can. It can become manifested. So the answers are A and C. Forget about the big English here and here. Okay.
A and class.
All right. Are we there?
Yeah.
Yes,
Okay.
please.
Let's see if we can get another question here.